who's watching us. My name is Unami Jeremiah, and I'm here with Dr. Harlem Brundtland, and we are going to be talking about universal health coverage. And we are live at the WHO in Geneva. Currently, the World Health Assembly is going on, and I just wanted to ask you, can you tell us a little bit more about what is universal health coverage? What does it mean? And why it is important?
Why it's important?
Yes.
Well, universal health coverage means that the right to health that is in the Human Rights Charter, it is in the WHO Constitution, already back from the 1940s. Everybody has the right to health. It is how do we implement that right to health in all countries. We are far from there now, because universal health coverage means that both health promotion, prevention, the different public health activities that are needed to prevent disease in the first place, from vaccines, pregnancy control, follow-up of young, newly born children, maternity, all of these issues are fundamental in every society. The question is, do people have access to all these services? And in many places, they don't. And then there is the financing question. If there is potential access, but people go broke and families get indebted, or they get into a financial crisis because they cannot pay for the service. That illustrates that to have universal health coverage, you also must have a system that not only reaches all with all the services they need, but also that doesn't lead to financial hardship. That's really basically what it is about.
Thank you for that. In the past 20 years, the world has made really great strive in terms of improving global health. But, so many people are still suffering from preventable diseases in 2017. And so I just wanted to ask you, what steps do we need to expand this access to quality health care?
The world has been working on many social and economic issues within the United Nations system, broadly speaking, for decades. And in 1987, I led a commission report on environment and development issues. It was called Our Common Future. We called for sustainable development to be the way that the world can combine environmental concerns, including health and democracy, with development that is based on democratic and a participatory approach, which means health and education. In the following years, which is now 30 years ago, that report came. Big UN conferences on key issues, such as population and family planning in Cairo, 1994, in Beijing on the rights of women, 95. They all pursued and followed up many of those principles. And of course, Rio, the first Rio conference on the environment, was in 1992. And it made many decisions already then on something called Agenda 21, which really listed all the principles of public action and government action, and of course everyone supporting it, that relates to people's lives for a sustainable development to be pursued. But then you had the Millennium Development Goals in the year 2000. 3 of those 8 goals at that time, 8 or 9, were linked to health. But now, in 2012, an initiative was taken in Rio Plus 20 that we should now formulate clear sustainable development goals for the world. Not only millennium goals, but a broader aspect including the environmental agenda. Now, the world signed up to this in 2015. And one of the goals, on the health goal, has a target in that sustainable development document called calling for universal health coverage before 2030. So, in fact, we have only 13 years now if we are going to pursue and implement universal health coverage in the way that we discussed earlier. And every country can do it, even poor countries. We have several examples of poor countries who have done it and that are spending 5% of public funding of their GDP into health. So poor countries can do it, so that means that many other countries cannot say it is impossible.
Yes. You've just come from a briefing with the WHO on universal health coverage. Can you give us a brief on what was the reception like?
Well, this was, as you say, a technical briefing on universal health coverage. And there were two former, or one existing, one coming, and one former Director General, all addressing this full room. And we basically all called for universal health coverage, the importance of it, how it is feasible, it's absolutely possible, and it's a right, we can do it. So I think there was a good reception among all those who were in that room on that vision. So, but the WHO can campaign, it can address the issue, it can speak with ministers of health, it can work on this issue, but fundamentally all governments are responsible to take care of their own people, And then people are responsible to be, if not activists, at least engage people in their own society to try to pursue the right policies in their own country. So here is an agenda for everyone.
During this year's World Health Assembly, there was much talk and attention on the private sector, because for the longest time, the private sector was just one of those sectors that was just not really involved when it comes to issues of public health and so on. But, what is your take on how they can be better players, and how can we really encourage or demonstrate more of multi-sector partnerships?
For global health and also for sustainable development, clean energy, a broader agenda, it is clear that unless we can engage the private sector in pursuing the goals that have been set, we are going to lose. We need everyone on board. So it is important to build alliances and to create partnerships also with private sector, to make private sector aware that they are not only responsible for their bottom line, they are responsible as well as governments and civil society for the kind of influence that and impact they make on the societies in which they work. Not only in their own workers, which is obvious, but even the community that those workers live in. And if I go 30 years back, few business people signed up to what I just said. Now, in the last 10 years, there has been increasing awareness among business people that in fact they have to be part of the solution. And that is also part of the solution with regard to universal health coverage.
That's very interesting, and it's inspiring to hear that everyone has to come to this table. We cannot leave. If we are going to achieve the Sustainable Development Goals, everyone has to be part of this conversation. And so I just wanted to also ask you, what gives you hope that indeed, as a globe, as a world, as different countries, as different people, we can achieve a world where everyone can survive and everyone can thrive?
Well, it certainly is important that the young generation have the right ideas and the right engagement for each other and for an inclusive society. You are young, so you have a chance now to dominate, the future of the world. I am 78 now, and I have been speaking and working on these issues for a lifetime. Mm-hmm. But it is very clear to me and to the other elders, which is a group that I represent, so that we really need to bring the younger generation into awareness about how important it is that we stand together and that we show solidarity to our fellow human beings, not only across borders, which is obvious, but also in our own communities, in the more local places where we live and in the countries that we help shape. So egalitarian policies is what I advocate. We don't want big gaps. It doesn't create good societies, harmonious societies. Everyone should be on board and everyone should be given a chance. And that means everyone should have good education in addition to good health. And we are all responsible together to have that happen.
That's fascinating, if I were to give it a word. And, just lastly, as we round up this interview, you've talked about how everyone has to be involved and how all of us have this great responsibility. And I just wanted you to share with us, the last thing on how do we hold ourselves, how do we hold our states accountable in terms of achieving universal health coverage?
Well, you certainly, first of all, people have to be aware of their rights. So one of the things I said in that technical briefing was that there needs to be campaigns explaining to people about their rights to health. Because if people don't even know, how can they advocate and how can they be active citizens trying to work together to support the right initiatives to benefit their own communities and the health basis of their own society? Mm-hmm. So, you need to be active. In many countries, you see that people don't turn up to vote. And I often say, if you don't even turn up to vote, if you are at least healthy enough to be able to, then you shouldn't be criticizing your political system or your society. Mm-hmm. If you haven't even made your own effort in a simple, civil duty, as I feel it is, that you put your vote. You try to think what politicians or what philosophies you believe in, and those values, you put your vote where you believe the country should go. So I'm appealing to young people, please, be active and please at least cast your vote.
Thank you so much. This brings us to the end of our interview, and, it's just a word out to young people like me to say, participate. It is your civil duty to vote. If you want our different countries to really attain and reach the SDG agenda, you need to be there at all levels, which include being part of the public policy making. When you cast your vote, you are on the first step of doing that. And also, when you know your rights, you are able to demand the services. You are able to demand what is due to you by your virtue being a human being. So thank you to everyone who tuned in from wherever you tuned in from. This is Unami Jeremiah signing off, and very warm thank you to Dr. Harlem for gracing us with. We know you are a very busy person, but we thank you for we thank you for this time. Thank you so much, and until next time, bye.